Healthcare providers across the country are aging or burning out across the nation, creating a shortage of providers at a rapid rate, especially in rural areas. KX News' Tyler Flipson takes a dive into the problem and sees how, despite the large shoes to fill, the next generation is taking the task head on.
The Health Resources Service Administration says in a 2023 report that the medical field is made up by more than 17 million people across all medical fields. But despite that massive number, it's projected that that number is only supposed to get worse heading into 2037, especially in rural areas. But despite those discouraging numbers, our future generation of healthcare providers are taking the challenge head on, no matter how tall the task is ahead.
I don't know, it fills my cup.
I think that this opportunity is just such a blessing.
It's with no secret the healthcare industry is struggling nationwide, with the majority either aging out or flat out burning out. But with the help of organizations like the Caring Foundation at Blue Cross Blue Shield of North Dakota, they have awarded scholarships all across the state to healthcare students just like Sarah Wabama, who's an occupational therapy student while also working at Missouri Slope.
Obviously, grad school is not cheap. So any type of financial assistance that I can get, this is a pretty big deal, actually.
While they are just one organization, their goal is to fill in the gaps.
So North Dakota continues to face a shortage of healthcare providers, particularly in rural and underserved areas. In North Dakota, about 1/3 of counties have a shortage of primary care providers, and nearly half of the state has a shortage of mental health professions.
J.C. Fisher is an exercise science student at the University of Mary and one of the 30 scholarship recipients. She says she likes that there's a high demand in her future career and doesn't feel one bit discouraged.
I think it's really cool to be rare, I guess. It has a lot of pressure to, stick with it and stick to it, but I think the ones that are able to push through, it really shows that you really do care a lot, and that's what you ultimately want in healthcare.
Furthermore, JC shared she has a calling specifically to those needing rural communities.
I love that, in a rural town, everyone knows everybody kind of thing, and for some people that's kind of a downside, but for me I love it. Everyone just kind of feels like family, and everybody has each other's back and is just fighting for what they have close to home.
The National Center for Health Workforce Analysis projects shortages across almost all specialties. But using only physicians as an example, at this rate, by 2037, non-metro areas will experience a 60% shortage. Understandably, burnout is very common. So these students take needed caution to prevent it.
I try and think of it not so much as a grand scheme, but just one person at a time. So if I can make a difference in one life, that's one life I've made a difference in, and that's a big deal to that person.
I grew up kind of farm and ranch family, and I love cows, I love being out there, and so for me that's something that is kind of my relief, my break, when I have a stressful, hard week of school, testing.
JC and Sarah are both students in different parts of their career, but they have the same passion to help others and are ready to do so. In Bismarck, I'm Tyler Flipson, KX News.
The Caring Foundation at Blue Cross Blue Shield of North Dakota awarded 30 North Dakota students this year with a $2,500 scholarship. They say they intend to back these students' passions and help them not be discouraged by declining numbers in their field.